LBC News.
So, junior doctors in England start their 4-day strike this morning, which bosses are warning will leave patient care on a knife edge. The NHS Confederation, which represents the health system, warns some hospitals will be unable to provide even basic care. It estimates 350,000 operations and appointments will be cancelled as a result. Well, joining me now is Dr. John Puntis, co-chair of the Keep Our NHS Public campaign and a retired NHS paediatrician. Dr. Puntis, good morning.
Good morning to you.
Let me ask you firstly then, do you believe it's right and justified that junior doctors are taking action for so many days in their dispute this week? Action which will clearly impact, won't it, on many, many patients' appointments, procedures and lives?
I think it's an indication of how desperate things are within the NHS that juniors have taken this very difficult decision. And I think it is tragic that we are in this situation. It could be avoided. It could have been avoided by Stephen Barclay engaging in serious discussions. And, last year there was a Commons Health Select Committee report which Jeremy Hunt chaired that committee, and it said the NHS has got its worst staffing crisis ever, that this is adversely affecting patient care. He actually advocated giving nurses a pay rise that matched inflation. Actually, the government have to own this. There is a crisis in the NHS. It's been building up for years, and the recent industrial unrest, including that by junior doctors, is a reflection of the fact that there is a severe crisis and that patients are already being severely affected. For example, the 500 deaths each week attributed to delays in accident and emergency. 7.2 million people on waiting lists, some of them getting worse, a lot of them suffering, and some of them dying. And we had 38,000 people stuck in A&E back in October on trolleys for longer than 12 hours waiting to be admitted. This is an absolute disaster for the NHS. The government commissioned a report from the Nuffield Trust last year to help it understand how this situation had arisen. And the Trust said, actually, it's years of neglect by the Tory government, underfunding, lack of workforce planning, running the NHS into the ground, inadequate capacity. So this is, the junior doctors, amongst other things, are flagging up this dreadful situation in the NHS, and the government need to take ownership of that. And they also need to sit down and talk seriously with the junior doctors about their pay claim.
Ministers, though, say their pay demand, 35%, is just unreasonable, it's unaffordable, and the government's also said it fully intends to train up more doctors and nurses to address the staffing crisis that you've graphically outlined. Doctor, though, you are a retired paediatrician. Say, though, you're a junior doctor right now and demanding that huge pay hike. How do you think you'd feel asking for such a rise while children were in wards urgently needing your care, perhaps?
Well, I think 35% is a negotiating position. It's not saying 35% or nothing. And it's based on the fact that the years of below inflation pay rises have led to a reduction in spending power of 26%. And then on top of that, now we have inflation and cost of living rises. So this is a restorative pay rise. And I know it sounds a lot, but you can turn it around and saying, is it fair that junior doctors have had to suffer such a large pay cut over the last 15 years amongst all the issues they're struggling with, like being burnt out from COVID, having their training very much interrupted by COVID, dealing with short staffing? I think it's a really sad situation. I mean, there was an article in the British Medical Journal where a young doctor was interviewed last week, and they talked about 3 of them being in charge of 500 patients over a weekend. And at the end of a 13-hour shift, when she'd seen 175 patients, she's shouted at by a patient who says, "Where have you been? You're not a good doctor. You're not a professional." And she went into a cupboard and cried in distress at that. And that's the kind of thing which junior doctors having to deal with on a daily basis, and they actually deserve the public support.
Won't it be really hard, though, to ensure fully functioning urgent and emergency care services in this 4 days of action? And if that aim fails, though, this week, some people may die as a result, mightn't they?
Well, we don't have fully functioning emergency services at the moment. The Royal College of Emergency Medicine held a meeting in the House of Lords last week to highlight this fact, and they've come up with this figure of 500 deaths a week from delays in A&E. I think the government should be really exercised over that, as should the public. We have 1 in 10 of the most sick patients awaiting admission, waiting now for more than 12 hours. So we don't, unfortunately, have a functioning emergency system in the way that it should do. This is a consequence of deliberate policies to underfund the NHS and not to plan for a workforce. Now, will things be worse in the strike? I think emergency care will be maintained, but a strike will have some impact. There's going to be lots of people who don't get their outpatient appointments. There will be investigations that are delayed. It's very difficult to estimate the impact of that. We do know from studies that if you look at patient deaths in hospital during medical strikes, they don't actually go up, and they didn't go up significantly in the 2016 strike. But yes, there will be harm done, but I think that has to be put in the context of the enormous harm that's being done to patients at the moment because of an NHS that's been run down.
And just yesterday, of course, we heard, didn't we, from the NHS Confederation urging people not to engage in, I think the quote was, risky behaviour ahead of this disruption. Well, for anybody involved in a genuine accident, that'll be clearly very hard to do. Where do you think then, just finally, Dr. Puntis, this dispute goes now?
Well, there has to be negotiation. There has to be a meeting between government, between Stephen Barclay and the junior doctors. I mean, that's the first thing. That's got to happen, and I think Mr. Barclay needs to stop being intransigent and actually misrepresenting what the BMA are asking for. And people should get over this 35% figure and recognise that that's a negotiating position and get down to negotiating. And I hope that this strike will focus his mind very much on that.
Really good to get your perspective this morning, Dr. John Puntis. Thanks for joining us live here on LBC News Breakfast. Appreciate it. Co-chair there of the Keep Our NHS Public campaign and a retired NHS paediatrician.